And the Kentucky Department for Public Health says whooping cough cases are increasing in the Commonwealth. The organization says it's a respiratory illness that spreads very easily. It can infect anyone, but infants are at greatest risk. According to UofL Health, the best way to prevent it is getting vaccinated.
It starts out like most viruses. That is, patients may present with mild cough, low-grade fever, just not feeling well, runny, congested nose. After about a week or two, however, those coughs become progressively violent and violent to the point where people can actually vomit.
Now, if you think you have whooping cough or someone in your family, UofL Health recommends calling your healthcare provider. They'll probably ask about your Tdap vaccine status, which the CDC recommends adults get every 10 years.